Good afternoon. I'm Elizabeth Bryant, and I'm a pediatric nurse here at the Children's Clinic of Lufkin. I would like to introduce and welcome Dr. Lauren Ford, a board-certified pediatrician. She serves children here in not only Lufkin, but she serves children in Woodville and Jasper as well in our outline clinics. Today I'm going to interview Dr. Ford about toilet training children in ages 18 to 36 months. Let's begin with asking some important questions about toilet training to support us in development and best practices in this area. What developmental signs indicate a child is ready to begin toilet training, and are there any specific cognitive or motor skills that support successful training?
I think the most important sign to look for is that they are interested in potty training. Mainly what you're going to see when you're assessing readiness for toilet training is if they care about having a wet or dirty diaper, if they're asking to be changed, or if they're starting to show signs that they notice when they need to go to the bathroom and then are able to do something about it. So some kids will start when they need to poop, they'll like go hide behind the couch or go hide in a corner. Or they'll tell you that they have a dirty or wet diaper and ask to be changed. It's great if they are able to walk themselves to the bathroom and help get themselves undressed, like at least help get their pants down. Now, some kids don't show these signs even when they're at an appropriate age, like 2.5, 3, to begin potty training. So sometimes we do have to help them along. But those are the things that you would look for in order to assess readiness for potty training.
Okay, can you describe how language development plays a role, and then what if a child shows interest but lacks some readiness signs?
Yes, I think if they're showing interest in the potty, go ahead and start trying, even if they're not showing some of those other signs. Because if you can get them on board with going to the potty, life is going to be a lot easier as far as potty training goes. Language development, so usually around age 2 is when kids have enough of a vocabulary to start putting 2 words together and forming short sentences. So, you know, they don't necessarily have to have the language to communicate to you that they need to go potty. It's great if they can tell you potty please or need potty or need poop, something like that. But honestly, if they can communicate with you at all, even if it's through signs or pointing or taking you with them to the bathroom, then we're in a good place.
Okay. And then what toilet training methods do you recommend for toddlers in this age group? And then how should parents introduce the potty or the toilet to them?
There's so many different methods and so many ways to do this. And I get this question a lot from families, and honestly, whatever, you're going to know your child best, and so you're going to have a good idea on what you think is going to work for them. So some people, you know, just trash the diapers and just go cold turkey to underwear, and, you know, they have a lot of accidents, but they eventually learn to use the potty. That's one method. Some people will start, you know, after meals. About 30 minutes after a meal, they'll take them to the bathroom and let them sit on the potty. And usually about 30 minutes after meals is when you need to go use the restroom. And so that gets them in the habit of associating, you know, that feeling with going to the bathroom. You know, a lot of times at the early stages, parents will take their kids with them when they go to the bathroom so that they can see the process and get familiar with all the steps. I think a lot of it depends on your child and what, if they're showing signs that they're interested, they're wanting to come with you to the bathroom, they want to flush the toilet for you, they're unrolling the toilet paper and trying to mimic what you're doing, then yes, bring them with you, get them their own little potty, let them start trying to do the steps independently. Those are all ways to introduce things. I think books and play can be very helpful. Reading books about going to the potty, demonstrating it with stuffed animals, things like that gets them used to the routine and the steps. But as far as the actual method of potty training, I think every kid is so different, and it also depends on if you're home with them all day and if they're in daycare. And so you're going to know better what method you think will work the best for them.
Okay, and then in terms for like timing and expectations, is there any ideal age or window that you find that starting toilet training is a little bit easier, or how long does toilet training typically take?
Yeah. The American Academy of Pediatrics recommends like age 2.5, 3, but I've had a lot of patients of mine that have potty trained earlier than that. So I think if you're ready and you think your kid's ready and they're interested, then you should go for it. Ideally, potty training doesn't take more than a couple of months. If it is taking longer than that, then it may be a good idea to bring them to the pediatrician and see if we can figure out what's going on. Like, are they having a developmental delay? Do they have something going on that, precludes them from being able to communicate well enough to establish this potty training routine? Now, if there are major life things going on, you can expect potty training to take longer.
Gotcha. Which that leads me to my next question. What are common signs of like regression, and how should parents respond to this? And then are there any ways that we can do to help parents set like realistic expectations for this?
Yeah. So any major life change can cause a regression in any type of development, but particularly in the potty training. So like if a new sibling is born, if there's a death in the family, if you move, I've seen it like if, dad started working the night shift, really any type of big life change can cause a regression in potty training. And what you're going to see is just more accidents when they hadn't been having accidents before. The key with that is just patience and consistency. So whatever method worked to get them potty trained, just start that method again and just be very patient with them. And in potty training in general, in the beginning or with their regression, it's important to not try not to bring a lot of shame on them when they do have an accident. Obviously, make it clear that you want them to use the potty, but all the research has shown that shaming and punishing them for having accidents actually prolongs the process and makes the regression worse. So just having a lot of patience with them is going to be the key.
Perfect. And then how should toilet training be adapted for children with developmental delays or sensory sensitivities? And then are there meaningful differences in training with boys versus girls?
Yeah. So I think for kids with, developmental delays or disabilities, it's really going to depend on their whatever specific issue they have going on. So like with speech delay, they may not be able to communicate well with you when they need to go, but you can usually find other ways to get around that, like have them bring you to the bathroom or things like that. As far as like severe developmental delays, if we're thinking like cerebral palsy or severe autism or things like that, that's when it gets tricky, because they may never show signs that they're ready to potty train. And I think it's important at that point to set expectations with parents on if potty training is ever going to be an option. Because we do have kids with, severe developmental delays and disabilities who are, in diapers their whole life, and that's never an option. And so at that point, it's important to have that discussion with parents and set those expectations. Because depending on what's going on, they may never be able to feel that sensation, know what it means, and know that they need to get themselves to the bathroom. So that's such a spectrum. It's hard to know. But kids with mild developmental delays, milder autism, things like that, we can usually get it going. It may just be a little bit later than the parents would like, or take a little bit longer. As far as boys versus girls, there's no research that shows that one is easier. You hear all the time that girls are a lot easier to potty train. I only have a son, and my experience was we had a rough time with it, but I don't have anything to compare that to.
Right.
So I don't know. The research says no, but anecdotally, everyone says that girls are easier.
I gotcha. And then in terms for like temperament, how does that affect the process? And then what strategies work for more resistant or anxious children?
Yeah. So this was our issue with my son, was like he did not want to stop playing to go to the bathroom. That was unacceptable. And he like really didn't care if he sat around in a dirty or wet diaper all day long. So what we ended up doing, and it was a little bit difficult because he does go to daycare during the day, but the cold turkey method is what ended up working for us. And so as soon as he would get home from daycare, like he didn't have an option. We took the pull-up off and we put underwear on him. And he had lots of accidents the first couple of weeks that we did that. And it probably would have been faster and more effective if we had all day at home with him doing this, but we didn't have that option. So we just did it in the evenings when he was home from daycare and we were all home. And like I said, he had a lot of accidents those first few weeks, and it was frustrating for all of us, including him. But we were just really patient, and we kept telling him, okay, this is what it feels like when you need to go pee. That's when you need to go potty. And it also helped because he was a boy, so if we were outside playing, he could just go pee on a tree. That was great fun. So that's what ended up working for us. And then finally one day we picked him up from daycare and they said, hey, he told us when he needed to go poop on the potty today. So Monday, go ahead and send him in underwear. And praise. And so then when he was in underwear all day at school, it went a lot faster. So I think if your kid has been really resistant to it and they're developmentally and, age ready to do it, sometimes they just need that push of they don't have the option anymore, we're using the potty.
Yeah, I'm glad that you brought up that situation with your son, because that leads me to my next question with how can parents coordinate toilet training across multiple caregivers and daycare settings, and then like what routines help to like reinforce training at home other than just patients?
Yeah. That was difficult because so when we first moved here and started our son in this new daycare, he had like just turned 2, and like 2 months after we had done that, put him in this new daycare, they asked if we were ready to start potty training, and we were not. Like us as parents, mentally, we had just moved towns and houses and all these things. Like we just had so much going on that we were not ready to start that process yet. And I think we missed a window when we told them no. Because then when we were ready to start potty training, they were like, oh no, he is not giving us any signs. Like he doesn't care that he's wet or dirty. We have to check him, all this stuff. And so that's why we started doing it just at home. So I think you need a conversation with whatever, if it's a daycare or a sitter or whoever watches them, figure out where they're at, because it's also totally valid for the childcare provider who has 13 other toddlers in this class. Like they can't focus all their energy on trying to potty train this one kid who is not showing signs that they're ready. So I totally understood them saying that they're not going to start that at daycare. So you would then start it at home. And like I said, that may prolong the process. But if you just keep at it, eventually they will get the hang of it. And so then if you can prove that you're doing really well at home and you think they're ready to start doing it at daycare too, they're going to be more open to having that conversation again.
Gotcha. And then what role would siblings or peers play in modeling this, and how can parents maintain consistency through like travel or schedule changes? Because I know you mentioned, whenever y'all moved here in terms of traveling.
Yes. Travel is hard, and I would definitely recommend starting the potty training process in a time where you don't have prolonged like vacations or traveling coming up. Because if they're still figuring it out, you're probably going to have accidents. And so we took even now, I mean, he's been potty trained for several months now, but if we're going on a long road trip, we go ahead and put him in a pull-up just in case. Because, he may decide he needs to potty when there's nowhere for us to pull over and stop. And he doesn't like going in a pull-up anymore, but at least we're not going to ruin the whole car seat, So I think with traveling, it depends on the distance and what you're doing and where they are in the process, but just know that if you have to put a pull-up on them for a couple days, it's probably not going to derail the whole situation. What was the first part of that? Sorry.
No, you're fine. And then what role do siblings or peers play in?
Yeah, I think older siblings and peers can be great because if they're already potty trained, and so your child is seeing that they're the only one in the house still in diapers, including this like relatively close in age, like peer pressure in this respect can be great and really work to your benefit. And that was the case with our son when kids in his class started using the potty at school, and he was able to see that and watch that. That helped us along as well. So I think that can be great. Unfortunately, it's not the case if there's a younger sibling in the house and you're trying to potty train the older one, because then they're looking going, well, they don't have to use the potty, but I do. What's that about? So I think it depends on the age of the sibling, whether it works to your benefit or not.
Gotcha, yeah. And then moving on to our next topic of like health and hygiene. I know you kind of hit some medical issues already that can interfere with toilet training. My next question would be, when should parents consult a pediatrician about the toilet training concerns?
I think anytime you have a concern, it's never wrong to bring it up to your pediatrician. Particularly if you're noticing things that like you think are not in line with kids of similar ages. Especially if like they were doing well at potty training and then they're having a regression and there hasn't been a major life change, that would definitely be a time to come ask questions and get an evaluation.
Okay. And then how can parents prevent or manage like constipation during training? And then are there any hygiene tips for managing accidents?
Yeah. Constipation is a super common issue, and we see it a lot around the time of potty training and then around the time they start school, like pre-K or kindergarten. And a lot of it is like it's a control thing. That's, kids very much want to be in control of their environments because there's so much that they don't have control over. And so withholding stool becomes something that they can control. I always recommend Miralax in these types of situations, and it's a powder that you can mix into their drink, and it just helps soften up their poop. And a lot of times parents have to just keep giving the Miralax until the kids don't have a choice; they can't hold it anymore. It's coming out whether they want it to or not. And then keep their poops really soft and regular so that, like I said, they don't have a choice. They have to get it out. Like it's coming out. And then that's a great way, give them the Miralax once or twice a day. And then after meal times, about 30 minutes after meal times, make them sit on the potty for about 20 minutes. And usually we can get that constipation under control.
Okay, perfect. But is there any tips that you would suggest for hygiene, for managing these types of accidents?
So obviously for girls, hygiene is much more important because you want to wipe, front to back and keep it away from the urethra and the vagina. So that because if you're getting poop up in that area, then girls are much more prone to get yeast infections and UTIs and things like that. So hygiene is much more important for girls. Still important for boys. We want to keep their skin and everything clean. And so the key is mainly, if they do have an accident, to get them cleaned up as fast as you can. Because the longer it sits on there, it's just really going to be really irritating to the skin. You can still it's messy, but you can still do like Vaseline and butt paste and things, even when they're wearing underwear, to prevent the skin issues if you need to.
Okay, gotcha. With our next topic, we're going to talk about communication and like emotional support with this. How should parents talk to their child about toilet training? I know you kind of mentioned earlier about shaming, and then of course, what emotional reactions are common and how can parents respond to this?
Yeah. Like I've said, the key is just to be really patient with them, set expectations and set boundaries, but try to avoid shame and punishment when they do have accidents. And it's also really important for all the caregivers to be on board with that plan, because if you've got one who's, punishing for accidents and one who's not, that gets really confusing for the child. So that's the main communication is going to be between caregivers, and then making sure everybody's on the same page when dealing with accidents. And accidents are going to happen, and it's, makes total sense for everybody to be frustrated when an accident happens, because that turns into a lot of cleanup and a lot of laundry, and it's just kind of irritating. And it's also common for the kids to be frustrated when they're not picking up on this, and it's clear that, parents are wanting them to. So it's mainly just going to be keeping your own emotions in check, and, making sure the kid knows, like, it's okay, accidents happen, but remember how this feels, and that's when you need to get to the potty. And a lot of times making them help clean up, or at least watching you clean up, so that they know that there are consequences for this, is also important. And that was something that was key with my son, was we stopped letting him just run off and play while we did all the cleanup. We made him help and watch, and we're rinsing this out in the sink, and now we have to put it in the washing machine, and we got to clean up the floor. And that helped him realize, like, oh, there are consequences. Like, it's not just me, this is affecting other people.
Gotcha. Yeah, that's super, super important, I feel like, too. And to kind of bounce off of that, what language helps build, like, the confidence and autonomy in the child?
Definitely, as far as when they have accidents, don't shame them. That's very important. But it's also important to praise them a lot when they do get it right. And that's where rewards and, sticker charts and all that type of thing come in. But when they do get it right, make the biggest deal out of it. Like, just praise them, keep bringing it up. Like, remember yesterday when you went to the potty? That was so good. Do you want to try again today? Things like that. Just tell other people, like, when call grandmother on the phone and tell them that they went poop in the potty, and it's so exciting, and get everybody on board and hype them up when they do get it right. Because they're going to respond to that much better than like shaming or punishing when they get it wrong.
Yeah, I totally agree. Now, with cultural and social considerations, how do cultural norms influence toilet training expectations?
I haven't noticed huge cultural differences when it comes to toilet training expectations here in the U.S. I mean, for the most part, everybody here uses, the disposable diapers and pull-ups and things, and everybody seems to potty train at about the same. I haven't noticed huge cultural differences when it comes to that. Now, when I have gone abroad to other countries, I have noticed differences, and mainly it's because they cloth diaper, and so that's a lot of laundry, and they're a little bit more motivated to get them potty trained earlier because of that. But here in the U.S., I haven't noticed huge cultural differences.
Gotcha. Are there cultural practices that support early training?
If they are cloth diapering, which I have seen that occasionally here in the U.S., those people do tend to try to potty train earlier, because that's a lot of work, and a lot of laundry. And I also think that the cloth diaper helps them learn that sensation earlier than a regular, like, disposable diaper or a pull-up, because you can feel that it's wet. And so I think kids learn to make that, like, sensation association earlier than they do in disposable diapers.
Gotcha. And then how can parents handle social comparisons or pressure when it comes to this?
That's so hard. That's so hard to do, because, like, I have patients come in that tell me that they got their kid potty trained at like 18 months old, and I'm like, how in the world did you manage to do that? Because we potty trained my son at 3. So just know that there's an age range that's normal for potty training, and just try your best not to play the comparison game, because every kid is different, every family situation is different, and so every potty training journey is gonna look different. And just because a kid that's the same age is showing signs that they're ready and yours is not, doesn't necessarily mean that there's anything wrong with your kid. They're just not there yet, and that's okay. So I know the comparison game is, as parents, can be really hard and really rough. And so that's why I say if you ever have concerns, always bring it up to your pediatrician, because we see kids of all ages, of all different developmental abilities. You know, it's all day long. That's all we do. And so we're going to be able to tell you, yeah, we need to look into this, or no, that is still totally developmentally normal and we just need to give them time.
Gotcha. Perfect. Thank you so much, Dr. Ford. One last question. Are there any screening tools or anything we can use with toilet training that you can tell us as on your side as a pediatrician?
There really aren't any screening tools specifically for potty training. It's something that we ask about, but most of the time, if there are issues, the parents bring it up to us. But yeah, there's not a screening tool specifically for potty training. It's mostly just all the other developmental screens that we do. You know, communication, motor skills, personal social interaction. All of those things have to come together in order for potty training to be successful. So we screen for all those things, and then we just know that if those are lacking, then we're probably going to have an issue with potty training.
Right. Well, thank you so much for meeting with me, Dr. Ford. I greatly appreciate it, and we've learned so much from you having this interview with me today, talking about toilet training, and we look forward to seeing you in the community in the future.
Absolutely.
Thank
Happy
you so
to
much.
do it.